So thank you, Tamret. Thank you, Success, for inviting me for this session, and thank you everybody who is here to listen to this conversation. For some questions, answers to those questions, and today we'll be discussing some updates on COVID-19. First of all, a little bit of basics, then vaccines, then updates, and then of course we'll take questions after the session also, during the session also. So the purpose of this session is that if you have any question, please ask, because I just want to make it interactive. I have prepared these slides thinking that what you need, but you know your need the best. So please feel free to ask question, and that will make it really useful for you guys. Okay, so here we start. So today we'll be talking on viruses, like a little bit of basics on viruses, coronavirus, then on COVID-19 testing. What are these variants of concern? You must have heard about these variants. Now, then we'll switch over to vaccines, how vaccines work. What is the process for new vaccines? Like, how do they come up in the market? How is their approval conducted? What about safety of vaccines? Because that's a big concern. And then we'll go specifically on COVID-19 vaccines and updates. We'll talk a little bit of details on the vaccines which have been approved in Canada. Then we'll come on BC operationalization part of this vaccination campaign, like what are the phases, how is that being planned, and lastly we'll talk about like why should you strongly consider taking COVID-19 vaccines, and we'll have Q&A session also. So please feel free, and Tamret, could you please interpret that? Thank you.
ኣብዚ ብምምፃእኹም የመስግን ሕቶታት ምስ ዘለዎኩም ሕቶቱ ማለት እዚ ዋላ እዚ ስላይድ የዳልዎ ዳእምር ካብ ዝወፃእ እውን እቲ ናትኩም ክህልወኩም ዝኽእል ሕቶ ኣብ መንጎ እንዳሓተትኩም ከም ዕላል ክኸውን እዚ ናቕርቦ ዘለና ፕሬዘንቴሽን ይድብለና ደሎ ዶክተር ቪሬንድራ ሕጂ እቲ ናይ ሎም መዓልቲ ንሽፍኖ ኣርእስትታት ከዓ ቫይረስን ኮሮና ቫይረስን እንታይ ብዛዕባ ኸዚ ክንዛረብ ኢና ምርመራ ናይ ኮቪድ-19 ከዓ ከመይ ምዃኑ እዚ እውን ክንዛረብ ኢና ብድሕሪኡ ቀፂልና እቶም ዓይነታት ናይ ኮቪድ-19 ደሰክፉ ማለት ደሻቑሉ ዓይነታት ወይ ዘርእታት እንታይ እዮም ክንዛረብ ኢና ቀፂልና ብድሕሪኡ እቲ ከመይ ገይሩ ይሰርሕ እቲ ክታበት ምስተወጋናየስ ከመይ ገይሩ ንዓና ክጠቕመና ዝኽእል ብዛዕባ እዚ እዩ ካብኡ ቀፂሉ ንዛረበሉ ኣርእስቲ እቲ ፈተነ ናይ ክታበትን ብኸመይ ይጸድቕ እቲ ናቱ ውሕስነት እንታይ እዩ ኢና ክንዛረብ ማለት እዩ ብድሕሪኡ ኣብዚ እዋን እዚ ንዘሎ ናይ ኮቪድ-19 ክታበትን ምዕባለታትን እንታይ ደሎ እቲ ኣፕዴትስ እዚ ክንዛረብ ኢና እተን ክታበት እዚአን ዘን ሰለስተ ዘን ፋይዘር ባዮንቴክ ሞደርና ኣስትራዘነካ ክታበት ድበሃለን ብዛዕባ እዚአን እውን ብዝርዝር እንታይ ፍልልዩ ብኸመይ ይሰርሕ ክገልፀልና እዩ ማለት እዩ እቲ ገጻት ናይቲ ክታበት ከመይ ይመስል ኣብ BC ብኸመይ ይጅምር መን ይቐዳምነት ድሕሪኡ ናበየናይ ደረጃ ንመን ኣየናይ ክፋል ናይቲ ሕብረተሰብ እዩ ዝወስዱ ከዓ ብዛዕባ እዚ እውን ክንዛረብ ኢና ማለት እዩ ብድሕሪኡ ንምንታይ የድልየና ንምንታይ ኢና ክንወስዶ ክንሓስበሉ ከም ዘለና ብዛዕባ እዚ እውን ክንዛረብ ኢና ካብዚ ቀፂልና እቲ ናይ ሕቶን መልስን ማለት እዩ ኣብ መንጎ ሕቶታት ምስ ዝህልወኩም ኣብ እቲ ናይ ቻት ባክስ ክትፅሕፉ ትኽእሉ እንዲሁም እንተዘይኮነ ኣብ መወዳእታ ኣብ ናይ ሕቶን መልስን ክህልወናይ ኣብኡ ኣብቲ ናይ ቻት ቦክስ ብትፅሕፉ ክንሓቶን ዶክተር ቪሬንደራ ንኽእል ኢና continue Dr. Virendra.
So first of all, what are viruses? We must have heard this word, heard this word by now for sure. And if you want to understand what are viruses, so the simplest definition is viruses are the simplest form of life. So when we say simplest form of life, what does that mean? That means they have minimum structures, minimum organelles to survive. So what are those minimum structures, minimum organelles? So they have a genetic material, and they have a covering for that genetic material, which will protect that genetic material. So this is basically the structure of every virus. So and what is genetic material? So genetic material is something through which characters are passed from one organism to its offsprings, to its copies. In the case of viruses, we usually use this term that these are copies, or these are new replicants of this virus. So usually when we say genetic material in case of viruses, it could be RNA, it could be DNA, it could be single-stranded, it could be double-stranded. So it depends. Like in humans, it's double-stranded DNA. So in viruses, and it could be any of these. In case of coronavirus, it's a single-stranded RNA. So this is like the uniqueness of this virus. And these viruses, like all the viruses, they are considered somewhere between living and non-living beings. So why is that? Because what happens is, like there is a virus and it could stay in dormant state for years and years, and then it could become live once it gets its environment. So if it enters a host cell which it is used to multiply in, so it will again relive, or it will again start replicating. So this makes them quite a unique organism. Is it non-living? Is it living? So there is still debate that some scientists consider it's non-living, some scientists consider it's living. Temrit?
Thank you. እንታይም ቫይረስ ዝነኣሱ ናይ ህይወት ካብቶም ናይ ህይወት ስስታይ ፎርምስ ዘለዎም እቶም ዝነኣሹ እዮም ይኽብለና ጸኒሑ ዝኾነ ህይወት ዘለዎ ከዓ ናቱ ጄኔቲካዊ ጥረ ነገር ኣለዎ እዚ ከዓ እቲ ጄኔቲካዊ ጥረ ነገር ንብሎ ዘለና ጠባይ ካብ ወላዲ ናብ ወላድ ክመሓላለፍ ዝኽእል ማለት እዩ ንግባል ክገልጸልና ጸኒሑ ብኡ ተመሳሳልስ ንዑ ዝመስል ክፈጥር ዝኽእል እዩ ሕጂ ካብቶም ድሓበረና እዚኦም ክፋል ናይዚ RNA DNA ኢሉ ክገልጸልና ጸኒሑ ማለት እዩ ሕጂ እዚኦም ግን ናይ ኮሮና ቫይረስ ሕጂ ፍሉይ ዝገብሮም ኣብ መንጎ ዝነብሩን ኣብ መንጎ ማለት ኣብ መንጎ ህልዋትን ዘይህልዋትን ዘሎ ቦታ ዝሓዘ እዩ ማለት ኣብ ዝኾነ ህይወት ዘለዎ ኣካል ምስኣተው ሽዑ ይራብሑ ማለት እዩ በዚ ሕጂ የለውን ግን ድሕሪ ግን ኣለዉ بخمس حكي يوم تدنبرو وي دبازحو مالتي شو continue.
So let's see whatever we have talked about, like what is a virus. So let's look at this structural diagram of coronavirus to understand what are viruses, and then what is this coronavirus. So here is the pictorial diagram, structural diagram of this coronavirus. So as I mentioned, so there is this genetic material, and as you can see here, there is just one string. So this is RNA, so it's called single-stranded RNA. Now this RNA is protected, is covered by a lipid layer. Yeah, so this is a lipid or a fat layer. Yeah, And then this fat layer has these protein spikes. So these spikes are made up of protein. So these spikes, they play a very important role in the in replication of this virus, in the life cycle of this virus. We'll talk about those a little bit later. And because these spikes, when first scientists discovered this virus, so they it looked to them like the spikes of a crown, and a crown in Latin is called corona. So that's why this virus was called coronavirus. Now, this is not for the first time that we are interacting with this virus, with this coronavirus. There are around 7 strains of this virus, 7 types of coronaviruses, which belong to coronavirus family. So they cause cold in humans, and other than that, there have been some serious illnesses which the family of this coronaviruses has caused in the past, and we'll talk about those in these next points. Tamrit.
Thank you. نريو دلنا مثلي ناي كورونا زي مالتي أتي خرينا تصنحها خم حنت فتليا دلوا تا كم قتليا ترى دلا مالتي بتسألي سخنو دحري بتوم كابس بحيز تسرحو زتخبى يو مالتي ويليبيدز قبلهم تصنحها مالتي توم بلحتي ويكمزي إشخص مسلو زبالخا كبروتين استسرح يوم هجي كابزي انترينا زيا كمز أخليليا تمثل زيا كورونا فيروس هجي كاب كراون ويكا أخلي نزا شو نزيا كورونا فيروس اتاشم توحيبوا. Continue.
Okay. So the viruses are very particular in the sense that they need only a very specific type of cells to multiply. What does that mean? That means that there are viruses of different, first of all, there are viruses of animal kingdom, there are viruses of plant kingdom, and then there are viruses of humans. And they usually live in their hosts, and they will live there, they will multiply there, they will die there. Viruses have been on this earth even before humans appear. So they have been here for millions and millions of years. There's a hypothesis that maybe life evolved on this earth from viruses. So viruses, they, as I mentioned, they are very specific types. So there could be viruses of respiratory system. There could be viruses of gastrointestinal system. There could be viruses of which will cause skin diseases. So they are very specific. Now, these coronaviruses, they are called respiratory viruses because they can only live and multiply in cells of respiratory system. So it could be respiratory system of humans, it could be respiratory system of some animals. We'll talk about which animals do they live in. So, and as I mentioned, in humans, they have been causing common cold, and we had some members of this coronavirus family which caused SARS. It appeared in 2003. So SARS was severe acute respiratory syndrome, and so that was an epidemic. It killed some thousands of people, but it was contained. And then again in 2012, we had another epidemic from a virus of same family, which was called MERS, Middle Eastern Respiratory Syndrome. And now we have this current one. Tamrit, please.
فيروس فلياتيوم يخبلنا تزنحو أبت وحيو نايتزنو برولو خاص تفلي نجار يدلو حجي أب أخنم كأيوالدو أو أخنم ما يموت حجي ناينسسات تخنم ناينسسات يوم نايسبات تخنم كا نايسبات يوم بزيم فلياتن تزمرت وخا ناتهم دبلو دولو مالج حجي مسؤول ما نايم استنفاس ديو نايم أنا تقولي نايز خونة نايز تفعل عليه كفال أكلات نايزي علو مالتهم زوم فيروس حجي أبسبات ترينا كم example نجدولو إزناي سارس ناي كرم حجي مالتيو أشحات تقاتل كالي إز مارس ون نيرو إزون كومو جن دتا واتعطرو مالتي زيهم عينت فيروس نيروم مالتي كمان ولا أتنريو أبانا قنفا كحزة كازخل نايكور رزخنا إزون كاب فيروس زمتي. Please continue.
So, as I mentioned, in 2003 we had SARS. So now in 2019, this was found for the first time that there was this severe respiratory illness was happening in people, and it was difficult to diagnose. And then later on, it was found that this was caused by this virus. So this virus was called as SARS-CoV-2 because this was very similar to the previous SARS. So this is SARS, severe acute respiratory syndrome, coronavirus 2. So that's why it was named like this. And the illness which it causes is called COVID-19. So COVID-19 is coronavirus disease, which was first seen in 2019. So that's why this is how this terminology works. This SARS-CoV-2 is sometimes also referred to as novel coronavirus because this is a new strain of this SARS virus which we encountered in 2003. Template, please.
جي إزي سارس أبكل تشحن سلستم ترى إنيرو جي إزي ناي حجي زرعنا يخا سارس كوف 2 نقولود لنا مسؤول تمساسالي سلزخوني كومو إلنا مسؤول كم كالعيش متصوعون نوفل كورونا تبعيلو يتصوع نيرو إزي خا إتي كوفيد أسرجعت بهالحمام زس مالتي.
So, because this is a respiratory virus, it lives only in the respiratory system. Yeah, respiratory system is like nose, then we have pharynx, larynx, then we have trachea, then bronchioli, then bronchioles, then lungs. So this lives in our respiratory system. And how does this spread? So this spreads through droplets, which are our mucus secretion. So it spreads through droplets, which are coming out either of our mouth, of our nose, and which are usually spread when we are coughing, sneezing, talking, singing. So this is how it spreads. So to spread it, it must reach from an infected person, it must reach a healthy person mucosa membrane in nose or eyes or mouth to enter that, because then it will cling to those cells of that respiratory system, and then it will first multiply in the nose, and then it will try to enter those cells. So this is how it works. To understand how minute, how tiny is this virus, you have to see this picture. So this is a cell on which these have been cultured, these coronaviruses. So you can see like how tiny is this virus. The viruses are usually very tiny, and this is like you can see what is the size of this virus. So in a droplet there could be millions and millions of this virus. So that's why public health measures are very important of putting masks and social distancing and washing our hands. Template, please.
Thank you. As SARS حمام زمالتي نايم استنفاس حمامي بكل خاء نتي كاب أفنجانا جمير سامبونا زلو يتك مالتي كم حلال فلو زخيل كاب أفنا خنطر زخيل كاب سعال ويكا حنت شو نبلولو ديزي كابانا خنطر زخيل يو زم حلالف مالتي تزرحا وحلو أبا فنج عندي زرابح كم يروحا مشتي يتقع خمس بسئل دلنا حجي كابتا حنتي نتار كندزي زاكل أزي بزحي تزرعنا زلو اتي كخون دخل اتي كلو زخل فيروس مالتي. Okay, continue.
Okay. So So where does these coronavirus come from? Like, where are they coming from? As we spoke about, like we had first in 2003, then in 2012, now in 2019. So where are these coming from? So as I mentioned, this family of coronaviruses, so they have been living for thousands and thousands of years in some animals. So so they live in these animals and they have been causing disease, multiplying, and then the cycle repeats. So if you see here, there are some of the examples from in which these coronaviruses have been living and multiplying. So this is civet cat, as we know. This animal is a raccoon dog. This is macaque monkey, like the normal monkey which we see in Asian countries. This is dromedary camel, and this is found in Middle Eastern countries. And this is ferret. So ferrets are farmed for their fur. And then this is bat. So these coronaviruses have been living in these animals for thousands and thousands of years. Temre, please.
هجي كورونا فيروس أبزيهم كنبري صنيح يمحلالف مالتي أبهم هجي زون إنساتات كمزي كنا يقرنا صنحة استفالاليو لليوم كاب سستاي مأكلاي مبرع لليوم كاب إيشيا لليوم كاب استفالالي بوتاتات زمتو إنساتات يوم أبزيهم تصنيحو اتي فيروس.
So the illness which I mentioned, severe acute respiratory syndrome, SARS-CoV. So it was transmitted from civet cats to human in 2003. Then the Middle Eastern respiratory syndrome. So this SARS-CoV it spread to around 25 countries and killed some thousands of people, and but then it was controlled. Okay, after that we had another episode of this MERS-CoV virus. So this came from these camels. So again, this virus jumped from those camels to humans, and this happened in 2012. Again, thousands and thousands of people died. It was more widespread. It was more deadlier, more fatal than the SARS-CoV. But again, it was contained. It couldn't spread that much. And now we have this COVID-19. So this COVID-19 is caused by the SARS-CoV-2. So the closest link of this COVID-19 SARS-CoV-2 virus is with the SARS virus, which is found in bats. This is the name of that virus, BAT-CoV RATG13. And this was recently, like in the month of February, this was declared by WHO. And so this, we know that this virus came from bats, but there has been, like, humans don't come very often in contact with bats. So there is some intermediate host through which this virus got transmitted from bats to that animal and from that animal to humans. So, but that animal is still not confirmed, like which is that animal. So this is still, investigations are going on. And several known coronaviruses are still circulating in animals, and they have not yet infected humans, but they might infect humans in future. Tamret, please.
ስለዚህ እዚ ስቀዳማይ ሳርስ ንብሎ ዘለና ኣብ 25 ሃገራት ተራእዩ ነይሩ ማለት እዩ። እዚ በዚ ሲበት ድበሃል ዓሊት ናይ ድሙኻኡ ብኡ ዝሓለፈ ማለት እዩ። ኣሽሓት ሰባት ቀሊሉ ድሕሪኡ መርስ ኮቭ ከዓ እዚ ከዓ እቲ ናይ ማእኸላይ ምብራቕ ማለት እዩ። እዚ ከዓ ካብ ገመል ዝሓለፈ እዚ እውን ብዙሕ ሰብ ቀቲሉ ግን እዚ እውን ይገድድ ማለት እዩ። ካብ ተቐድሚኡ ነበረ ሳርስ ግን ተቆፃፂሮሞ ከዓ ሕጂ ብድሕሪኡ እዚ ሕጂ ንሪኦ ዘለና ማለት እዩ። እዚ ሳርስ ኮቭ2 ብከምኡ ዝመሓላለፍ ወይ ከዓ ናይ ኮቪድ-19 ቫይረስ ኮይኑ እዚ ከዓ ተመሳሳሊ ዘለዎ ምስቲ ኣብተን መንካዕ ዘሎ እዩ ግን ርግፀኛ ኣይኮነን ምክንያቱ ሰባትን መንካዕ ደሎ ብሆነ እቲ ርክብ ስለዘየለ ከምዚ ንበሎ ካልኦት ዓይነት እንስሳታት በቀረባ ምስ ከምዚ ገበን ምስ ሰብ በቀረባ ብሓደ ክነብሩ ናይ ገዛ ገለ ስለ ዘሎ ግን ምስ መንካዕን ሰብን ዘሎ ወላ ሓንቲ ነገር ስለዘየለ ግን እቲ ኣብ መንጎ ክህሉ ዝኽእል ርክብ እቲ ኣብ መንጎ ደሎ ዝኾነ ካልእ እንስሳ ካብ ሓደ እንስሳ ናብ ሓደ እንስሳ ናብ ካልእ ሓደ እንስሳ ሓሊፉ ካብኡ ብድሕሪኡ ከምኡ ኢሉ ናብ ሰባት ይሰጋገር እቲ መንጎ ዘሎ እንስሳታት ግን ኣይተፈልጠን ደሎ ማለት እዩ ኣብ ልዕሊ እዚኦም ዝተፈልጡ ዝተፈላለዩ ኮሮና ቫይረስ ዝኾኑ ኣብ ንደቂ ሰባት ስጋ ሕጂ ዘይለኸፍዎም ዝተፈላለዩ ዓይነት ኣብ እንስሳ ዝነብሩ ኮሮና ቫይረስ ኣለው
So why are these viruses jumping from those animals to humans? Like what are those conditions? Why is this happening so often? So it's because of some multiple factors, overpopulation. Then there is one of the reasons when there are more chances of some viruses jumping from one animal to other animal or to humans is when there are close contact. So there is if there is meat consumption which is uncooked, which is raw, then these situations will lead to viruses jumping from one species to another. If there is a farming of animals or too much animals are being kept very close and then humans are coming in contact with them, so those are the conditions which are very favorable for these skipping of these viruses from one species to another one. Tamrit?
ንምንታይ እዚኦም ዝሰጋገሩ ደለው ካብ ሰብ ናብ እንስሳታት ብኸመይ ከልና እዚ ሕጂ እቲ ብዝሒ ሰብ ይበዝሕ ስለ ዘሎ ኣብቲ ናይ ቦታ ናይ እንስሳታት እውን ክነብር ይጅምር ሞ በዚ ዝያዳ ይቀራርቡ ስለ ዘሎ በዚ ክኾን ይኽእል ካልእ ሰብ መግቢ ዘይተቐልወ መግቢ ኣብኡ ኩሉ ብጥሪኡ ስለ ዝበልዕ በዚ እውን ሓደ ምክንያት ኣሎ ብድሕሪኡ ብሳልሳይ ገለፁ ከዓ ናይ ሕርሻ ናይ እንስሳታት ብብዝሒ ይግበር ሞ እቶም ሰባት ከዓ ምስኦም ቀፃሊ ርክብ ምዝህሉ ናብ እናብትን እንስሳ ይቐርቡ ምዝኾኑ በዚ ከዓ እቲ ቫይረስ ናብ ሰባት ክሓልፍ ይኽእል
Okay. So we have discussed these two slides so far, and now we'll be moving on to testing and all. So do we have any questions, any thoughts, any comments, any things, any confusions which are in your mind, and please share, and so that we can elaborate, or if you have any questions on any of these points. Tamrit, please.
ሕቶታት እንተለኩም ስጋሕጂ ዘን ክልተ ስላይድስ ወዲእና ኣለና ድኾነ ደይበርሃልኩም ነገር እንተሎ ድኾነ ክትሓትዎ ትደልዩ ነገር እንተሎ ክትሓቱ ትኽእሉ ኢኹም
No? Okay, so we'll move on to the next one. Okay, so how does this virus spread? Yeah, like as we have talked about it, spreads through droplets, through cough, sneeze, talking, singing, primarily infects the lower respiratory tract. So it will multiply first in our nose and then it will enter our lungs and then it multiplies there, causing acute viral pneumonia symptoms. So initially there will be flu symptoms like cold and flu symptoms, and we've seen a range of symptoms in this virus. It could be stomach ache, it could be pink eye, it could be, of course, fever, headache, sore throat, all a wide range of symptoms. And there has been rapid changes in conditions of patients. Like somebody could be pretty okay like day one, but by day 4 he or she has to be admitted to ICU. And what about outcomes? So in majority of cases, people have recovered. In some, there have been serious illnesses and they have been followed by long-term complications, and in some people, it has caused death also. So this is like a whole spectrum of this illness. There is majority, there is recovery, but there is death also. So that's why it's a very serious illness. Tamra, please.
እዚ ብምንታይ ይመሓላለፍ ከዓ ብነጠብጣብ እዩ እቲ ካብ ክንስዕሎ ንኽእል ወይ እንትሸው እንተኢልና ወይ ብዘረባ ወይ ብደርፊ ካብቲ ካብ ኣፍና ክነጥር ዝኽእል በዚ ይመሓላለፍ ማለት እዩ። እቲ መጀመርያ ዘጥቅዖ ነቲ ታሕተዋይ መተንፈሲ ኣካላት እዩ ዝትንክፍ ማለት እዩ። ብድሕሪኡ ሽዑ ከምኡ ኢሉ ነቲ ላዕለዋይ ክትንክፍ ይኽእል ማለት እዩ። ከቢድ ናይ ሳምቡእ ነድሪ ከስዕብን ይኽእል ከምዚ ንሪኦ ዘለና ናይ ኒሞንያ ዝመስል ምልክታት ኣብ ልዕሊኡ እውን ከም ዝተፈላለየ ከም ጉንፋዕ ዝመስል ከሎ ቅርፀት ርእስኻ ምሕማም ካልእ ዝተፈላለየ ዓይነት ምልክታት ካብ ሰብ ናብ ሰብ ይፈላለዩ እዚ ከርእየና ይኽእል እዩ እንጂ ኣብ ቀዳማይ መዓልቲ ድሓን ፀኒሖም ሰባት ብኡ ምስ ተታሕዙ ኣብ ራብዓይ መዓልቲ ግን ኣብ ሆስፒታል እውን ክኣትዉ ይኽእሉ እዮም እንጂ እቲ ይፈላለዩ እቲ ናይቲ ሕማም ማለት እዩ። በዚ ብሰንኪ እዚ ቫይረስ ብዙሓት ሓሚሞም ብዙሓት ሒሽቦም ግን ዝሞቱ እውን ኣለዉ።
So what about testing? So if anybody has any cold symptoms, influenza symptoms, or they think that they might have this, so testing is available. So one of the steps people can do is like go to this website, bcthrive.health, and click on the link, this one, and you will get a questionnaire. So in that, this question is now available in 10 languages, and you have to answer like yes, no question, and at the end of it, it will say like, yeah, you should get tested, or you don't need to get tested. Even if you feel that either you are not comfortable or you cannot access this one, or you are unsure, so you can always call your healthcare provider, your doctor, or you can always call 811. So 811 is the health line which answers health related questions in 130 languages, including Tigrinya, and you can ask them questions in your language. It works 24/7, 7 days a week on any health issues questions, health issue related questions. For Fraser Health residents, there is this number which you can call 7 days a week from 8:30 to 4:30 if you have any questions on testing, or if you want to get tested. Yeah, Tamra, please.
Okay, thank you. ድሕሪ ምልክታት ናይ ኮቪድ-19 እንተለካ እንታይ ትገብር እዩ? ምርመራ ኣሎ። ዝኾነ ሰብ ቁሪ ወይ ከም ጉንፋዕ ድመስል ወይ ከዓ ኮቪድ-19 ድመስል ምልክታት ንዘለዎ ሰብ መርመራ ኣሎ ማለት እዩ። ባዕልኻ ትገብሮ ዓይነት ገምጋም ወይ ከዓ መርመራ እውን ኣሎ። እዚ ሕጂ ከምዚ ኣብዚ ዌብሳይት ብምእታው ክንሪኦ ንኽእል ማለት እዩ። ኣብዚ ብምእታው ብ10 ቋንቋታት እዩ ዘሎ ናይ ነብስና ናይ ባዕልና ገምጋም ኣለና ድየብልና መርመራ ክንወስድ ንኽእል ማለት እዩ። ካብኡ ብካልእ እዞም ምልክታት ናይ ካልእ ዓይነት ሕማም ክኾኑ ስለ ዝኽእሉ ድሕር ደይፈለጥና ከይከውን ይኽእል ክኸውን ይኽእል ድሕር ርግፀኛ ዘይኮንና ነቲ ናትና zostaje در فامیل دکتر علنا هم او کنحت نخل و یک نب شمونت حد کندول نخل مالتی جی شمونت حد این سالسان قام قاطع آلو کدام ناتسمی دکتر این بتگرینیا من آلو إذن معي زون نابدو لنا بتجرينا حتيتنا تندلي حبريتها حمرك نخلينا تتصل حلو معلتاتك شو عت معلتات أرسون يمسول حسي معلتاوي أبتزت أمامنا كن حت نخلينا እንጂ ነበርቲ ናይ ከባቢ ክንክን ጥዕና ፍሬዘር ምስ ንኾንካ በዚ ኣብ ስክሪን ዝረአየና ዘሎ ቁፅሪ ደውልና እዚውን 7 መዓልቲ ካብ 8 ፈርዓን ሳብ 4 ፈርዓን ይሰርሖም ክንፈልጥ ንኽእል ኢና Doctor.
Okay. So that was on testing and symptoms. So a little bit on variants of concern. So you must have heard like new variants are here and they spread faster. Some of them are deadlier. So what are these variants? Like how do we understand these variants? We won't go too much in details, but like very basic. Like what is the difference? So this is SARS-CoV-2 virus, yeah. And as I mentioned in the beginning, this is its spike protein. So in this spike protein, there is this region. There is this part of this spike protein. It's called receptor binding domain. So why is this called receptor binding domain? This is through this part of this spike protein, this virus interacts and enters into human cells. So this is the receptor binding domain, yeah. And what happens, and so if you see it here closely, so this is a 3D diagram of amino acids of this receptor binding domain. And what happens is like when there are multiple mutations is like when there are significant changes from the original virus in the offspring of that virus, in the child of that virus. So there are multiple mutations, more than a dozen mutations. So that changes this might change the infectivity of that virus. This might change the lethality of the virus. So this virus, then the resulting strain is little bit different from the parent strain. And if this strain is evolutionarily better means either it could spread fast or it's deadlier. So that means it's different from the original strain. So these are called as variants of concern. So today we have like till date we have seen UK variant, South African variant, Brazilian variant, and so on. Like there could be other also, and there will appear more variants also in future, because as this virus goes throughout the population, so there will be changes in that virus. This virus will try to adapt more. This virus will try to be evolutionarily more fitter. And what does that mean? That means like anything which will help this virus to spread faster, to infect more people, it will happen, because this is how these viruses have been evolving, yeah. And what has happened is one of the example of this one is if you see this UK variant of concern, so it spreads way faster. So when it was first recognized in UK, as you can see here, as compared to EU, European Union, where it was in like the normal virus was infecting only 254 people per million, but the UK variant was already infecting 773 people per million. And this is estimated that today in US and in Canada, probably variants are more dominating strain than the parental strain. Tamret, if you need my help, so I could repeat that also, please. Yeah.
Okay. እዚ ሕጂ እቲ ንሪኦ ዘለና እቲ ዝገለጸልናይ እዚኦም እቶም ከምዚ ውይ ዝበሉ በላሕቲ ነገር ድብልናዮም ኣብኡ ከዓ እቲ ፕሮቲን ዘለዎ ማለት እዩ። ሕጂ ዝያዳ ንዓኣይ እዩ ኣብዚ ኣጉልሑ ደርኤና ዘሎ ማለት እዩ። እዚ ከዓ እቲ ምልክታቱ እንታይ ለውጢ ይገብር ኣሎ፣ እቲ ቫይረስ ይምዕብል ኣሎ ማለት እዩ። ድሕር እቲ ሓደ ነይሩ ውላዱን ክመፅእ ከሎ ዝያዳ ተጓዳእን ሓሳይን ኮይኑ ይመፅእ ማለት እዩ። ሕጂ ከምታ ኣብታ ወይ ካልእ ከም ኤግዛምፕል እንታይ ዝያዳ ይመሓላለፍ ቀልጢፉ ይላባዕ ንበሎ ድሕሪ 10 ሰባት ሒዝ ነርቱ ኮይኑ እቲ ቀዳማይ እቲ ድሓራይ ግን ኢቮልቭ ምስ ገበረ ምስ ዓበየ ግን እቲ ምስተለወጠ ማለት እዩ እቲ ቫይረስ ኣክንዳ 10 ሚእቲ ሰባት ክሕዝ ይኽእል 1000 ሰባት ክሕዝ ይኽእል ማለት እዩ በዚ ከዓ ዝያዳ ሓሳይ ወይ ተጓዳኢ ይኸውን ሕጂ ከምቲ ኣብታ ድሕሪ እዚኣ ዘላ ከርእየና ዝፀንሐ ሕጂ እዞም ዘርእታት ወይ ዓይነታት ናይቶም ኮሮና ቫይረስ ማለት እዩ ናይ ዩኬ ኣሎ ናይ ሳውት ኣፍሪካ ኣሎ ብራዚልያን ወይ ከዓ ናይ ካልኦት ዘርእታት ደለው ኣብታ ናይ ሕብረት ኤውሮጳ 200 ገለን ክተሓዙ ከለው ወይ ክጉድኡ ከለው ኣብቲ ናይ ዩኬ ናይ ዓዲ እንግሊዝ ዘርኢ ግን እቲ ዝተለወጠ ዝያዳ ተመሓላለፉ ኮይኑ ዝዓበየ ዝተቐየረ ሳርስ ኮቭ 2 ማለት እዩ ዝያዳ ቁፅሪ ሒዙን ዝያዳ ሰባት ይመሓላለፍን ካብ ሰባት ናብ ሰባት ማለት እዩ Yes, I've covered that as well.
Vaccines and do we have any questions so far? Like whatever we have discussed so far? Any questions on whatever we have discussed, or we'll go on vaccines? Any questions so far, please?
ሕቶታት ድኾነ ይህልወኩም ድኹን ድሕር ሕቶታት ኣለኩም ኮይኑ ኣብታ ብቻት ቦክስ ኣላ ሃይ ኢለ ክፅሕፈልኩም እየ ኣብኣ ሕቶታት ምስ ዘለወኩም ኣብዚኣ ሕቶታትኩም ክትፅሕፉ ትኽእሉ ኢኹም
Okay, no? Okay, so we'll move on to vaccines now. Okay, so what are vaccines? So first of all, we have to understand the concept of vaccines, and to understand, we have to understand the concept of infection. So what is infection? So infection is some pathogen, some organism causing illness in humans. Yeah. So it could be a virus, it could be a bacteria, it could be a fungi, it could be any of those parasites. So what is in a vaccine? So the vaccine contains the same germs that cause illness. So suppose suppose let's talk about COVID-19 vaccine. So COVID-19 illness is caused by SARS-CoV-2 virus. So what is in the vaccine which is being given now? So generally in all the vaccines there will be either the whole virus or bacteria, but that will be either killed or attenuated. Attenuated means weakened. So one option is you have the whole virus or bacteria which causes that illness, which has been weakened or killed. So a killed virus or bacteria is in that vaccine. Second option could be there could be a part of that virus or bacteria which causes that illness. Yeah, and then it could be like these three options. So either a live but weakened virus, a dead virus or bacteria, or a part of that virus or bacteria. So what happens is, like when this vaccine is injected into our body, so that vaccine has a pathogen. Whether it's killed or living, that doesn't matter to our body, because our body thinks that some foreign pathogen has come from outside. And to every pathogen which entered our body, even if it entered through mouth or if it enters through nose, our body, if it reaches our blood and it's still live, so our body will make antibodies against that virus, our body against that pathogen. Our body will make immune cells, specialized immune cells against that virus or pathogen. So I got the vaccine. The vaccine had a killed virus. My body thought like this is a pathogen, so my body made antibodies, special immune cells to that virus. So they are now in my blood. Those antibodies and special immune cells are in my blood, which are specific to this virus. When the actual virus will come, when the actual pathogen will come, my body will already have antibodies and those immune cells. So it won't let that virus multiply. It will try to kill that virus. It will try to stop that virus from entering cells. And because my immunity is very effective. Those cells are very specific, so it won't let that virus or bacteria take over, and those special immune cells will kill that virus, and I won't fall sick, and I'll be healthier. So this is the concept of vaccines, and this is what it is shown here. Like the vaccine has dead pathogen. So once the pathogen is introduced into our body makes soldiers, our immunity soldiers. And once the actual pathogen will come, we will have enough of those soldiers, enough of those antibodies, enough of those immune cells, and they won't let this new pathogen take over this body. So this is how the vaccines work. Tamrat, please.
ስለዚ ክታበት እንታይ እዩ ኢና ክንብል ፀኒሕና እቲ ክታበት ሕጂ ባዕሉ እቲ ሕማም ዘምፀና እቲ ካብ ደገ ዝመፅእ ከም ፓራሳይት ንብሎ ማለት እዩ እሱ እዩ ግን እንታይ ልክዕ እሱ ዘይኮነ ዝደኸመ ኣዝዩ ዝተደኸመ ክኸውን ይኽእል ወይ ዝሞተ ክኸውን ይኽእል ወይ ከዓ ክፋል ናቱ ናይቲ ጀርም ክኸውን ይኽእል ማለት እዩ ሕጂ እዚ ጎዳኢ ንነብስና ጎዳኢ ስለ ዝኾነ እቲ ናትና ኣካልና እንታይ ይገብር ፀረ ነብሳት ንዖም ክቐትል ድኽእል ይሰርሕ ማለት እዩ እዚ ኸኣ ንዓና ይከላኸለልና ማለት እዩ ድሕራይ ሽዑ እቶም ናይ ብሓቂ ቫይረስ ምስ ሓዙና እዚ ተዳልዩ ስለ ዝፀንሐ ነብስና ናይ ብሓቂ ምስ መፀ ይቐትሎም ማለት እዩ ሕጂ እዚ ብስእሊ ንደለና እሱ እዩ ማለት እዩ እቲ ዝደኸመ ናይቲ ዓይነት እቲ ሕማም ክፋል ናቱ ክኸውን ይኽእል ወይ ድሞተ ክኸውን ይኽእል ወይ ከዓ ዝደኸመ ናቱ ኣብ ንኣቱ እሞ እቲ ነብስና ከዓ እዚኦም ከም ምልክት ከም ወታደራት ገይሩ ዝከላኸል ይፍሪ ድሕራይ ናይ ብሓቂ ምስ መፁ እቲ ነብስና ኦሬዲ ተዳልዩ ስለ ዝፀንሕ ኣንፃሮም ተስዩ ክከላኸለልና እቲ ናይ ስርዓት ምክልኻል ናይ ነብስና ዝያዳ ክሰርሕ ይኽእል Doctor.
Okay. So once let's talk about a new vaccine. Let's talk about COVID-19 vaccine. So how are vaccines made? Like, what is the procedure? So first of all, once we plan to make a vaccine against some illness, so first of all, that vaccine is tested among animals. Okay, so what are the concerns there? So the concerns are, first of all, does this vaccine work and is it safe? So these are called like preclinical studies when it's tested on animals. Okay, so once it's found to be safe and effective, then starts the clinical phases. So clinical studies means in humans, volunteers, the new vaccine is tested. So in the phase 1, there are like around 80 or 100 volunteers, those who are given this this vaccine candidate, and then it's first reviewed, like, is it safe? Is it working? Does it appear to work? Okay, so everything is good, then we enter the phase 2. So in phase 2, there are some hundreds of volunteers, maybe 400, 500, 800. Again, the concern is, the data is reviewed, is it safe? What's the best dose? What should be the schedule of that vaccine? And then the phase 3. So in phase 3, there are thousands and thousands of volunteers. 1,000 means 40,000, 30,000, 80,000. Again, the concern is it safe? How well does it work? Or what is the efficacy? Okay, so these 4 phases, these are done by the manufacturer of that vaccine. So once the vaccine is found to be safe and effective, so then this whole data is given to the countries. Like in Canada, this whole data in the case of Pfizer BioNTech and Moderna. So this whole data of clinical studies and preclinical studies, it was given to the Health Canada's department, which is called as BRDD, Biologic and Radiopharmaceutical Drugs Directorate. So this BRDD department reviews the data, sees the efficacy, sees the safety data, and when this department is satisfied, then they will say, okay, so then comes the role of NACI, National Advisory Committee on Immunization. So then this committee decides like how it will be phased in the whole of provinces of Canada. So this is how it works. And But safety is always a concern. If you see here from preclinical studies to clinical studies, safety is always the #1 concern. And in the case of COVID, of these Pfizer, BioNTech, and Moderna vaccine, in the third phase, a total of 72,000 volunteers got these shots. So and when everything was found to be okay, then only then this data was shared with the health departments of countries where it was submitted for approval of that vaccine. Temret, please.
Thank you. እዚ ሕጂ ብዛዕባ እቲ ፈተነን ምፅዳቕን እቲ ክታበት እዩ ማለት እዩ። እዚ ከዓ እዚ ሰለስተ ገጻት ኣለዎ ማለት እዩ። እቲ ቀዳማይ ስጉምቲ ቅድሚ ክሊኒካዊ መፅናዕቲ ዝበሃል ማለት እዩ። እዚ ከዓ ቀዳማይ ስጉምቲ ዝውሰዶ ኣብ ላቦራቶሪ መፅናዕቲ ማለት እዩ። ድሕሪ እዚ ካልኣይ ስጉምቲ ኣብ እንስሳታት ይፍተን። እዚ ከዓ እንታይ ክሰርሕ ይኽእል እዩ ውሕስ ድዩ ንዝብል ሕቶታት ንምምላስ ማለት እዩ። ብድሕሪኡ እዚ ኣብ ደቂ ሰባት ምፍታን ማለት እዩ። ምስሊ ናይ ሰባት ንሪኦ ዘለና እዚ እቲ ናይ ክሊኒካዊ ፈተነታት ዝግበረሉ ማለት እዩ። ቀዳማይ ገፁ ሕጂ እንታይ ካብ 100 ዘይበዝሑ ወለንተኛታት ኣብኦም ይፍተን። እዚ ከዓ ውሕስ ድዩ ንዝብል ዝሰርሕ ዶ ይመስል ኣሎ ንዝብል ሕቶ ከዓ ይምልስ ማለት እዩ። ካብኡ ቀፂሉ እቲ ካልኣይ ገፅ ንብሎ ዘለና ኣብ ኣማኢት ወለንተኛታት ዝግበር ፈተነ ማለት እዩ። እዚ እውን ውሕስ ድዩ ክንደይ ዝኣክል ዓቐን ወይ ከዓ ኣብ ክንደይ ግዜ ክወሃቦ ኣለዎ ንዝብል ከዓ ሕቶታት ይምልስ ኣብዚ ማለት እዩ። ዳሕራይ ኣብ ሳልሳይ ገፅ ኣሽሓት ዝኣኽሉ ወለንተኛታት ይፍተን ማለት እዩ። ሕጂ ብመሰረት ዶክተር ቪረን ዝራኽብለና ፀንሐ 72,000 ተፈቲኑ ኣብ ናይ ኮቪድ-19 ማለት እዩ። እዚ ከዓ እሱ ውሕስ ድዩ ክሳዕ ክንደይ እዩ ውፅኢታዊ ንዝብል ይምልስ ማለት እዩ። ድሕሪኡ ንክፀድቕ እንተኮይኑ ናብ BRTD ናብ እዚ ትካል ይኸይድ ማለት እዩ። ሕጂ እዚኦም መን እዮም? እዚኦም እቶም ኣፍረይቲ እዮም። ሃገራት ደይኮነ ኣፍረይትን ድዮም። እተን ደፅድቆ ከዓ እተን ሃገራት እየን። ሕጂ ኣብ ናይ ካናዳ እዚኦም BRDD ንብሎም ዘለና ባዮሎጂክ ኤንድ ራድዮ ፋርማሲቲካል ድራግስ ዳይሬክቶሬት ዝበሃሉ እዚኦም የፅድቕዎ ማለት እዩ። ውሕስ ድዩ ወይ ከዓ ውፅኢታዊ ድዩ ንዝብል ሕቶ ዶክተር።
Okay. So once a new vaccine is introduced, so is it over? No, it's not over. So once a new vaccine is introduced into public, so then starts surveillance of adverse events. So what are it's called adverse event following immunization. So what is the adverse event? So adverse event is any untoward incident which was not supposed to happen with the vaccine. It could have been because of vaccine, or it seems to be because of vaccine. So there starts the surveillance of this these untoward incident. In Canada, it's called Aefi surveillance system. So what is this Aefi? So what is the, first of all, why do we need this? So we need this because in the clinical trials, it's usually when the vaccine is given to those volunteers, it's monitored for 3 months, for 4 months. But what about rarest of rare cases, like something would happen after 5 years, after 10 years, say 15 years, 20 years, 30 years. So what if something happens? So to rule out those rarest of rare events, this Aefi monitoring system works. So what is this system? So what happens is, like the provider who is giving the vaccine, if he is notified by the patient that the patient had some untoward incident which was not expected, so that provider will review the case, the incident, and then he or she will report it to the local health authority, to the local medical officer. They will also review the data. Then it's shared with provincial BCCDC. In the case of BC, it's BCCDC, BC Center for Disease Control. So from here, it's reported to federal level. So at federal level, this department will receive, track, and analyze those reports. And from there, this report is shared with WHO. So there are a total of 75 countries, and Canada is part of that group, which report to WHO on regular basis any untoward incident, not just because of this new vaccine, any vaccines which are being given to children, to adults, tetanus, diphtheria, measles, all those vaccines which we have given to our children. So there is this surveillance system which works globally. It's not just for Canada. It's like there are representative countries, like they have chosen random countries, and Canada is of course part of them, but this works in almost all of the countries, and they will report it to WHO eventually. So this is just to rule out rarest of rare events, rarest of rare adverse events. Tamrat, please.
Thank you. Okay. إذا صعبات دحنت نايتي كتابة زقوات عطار مالتي تعلموا انتينا علامة مقصصار دحنت نايتهم حليفهم زقاتهم علوتهم سابينات نمللاي حجي كنت دبلنا ولا حج انت طلعت مرهني دحر 10 عامات 15 عامات 10 عامات دخونا علوتهم سابين ويوتصيت مسلو زي نبلو دلنا مالتي as the adverse event following immunization نبلو دلنا مالتي زحجي ماني زحبر مجمريا اتي حموم اتزتوق كم زقواني في زخوينا يبدمو كاو قصيلو اتم وحاتي كنتنا يخونو تهزبي مالتي دحر خطابت زقاتمو التاو اغاطمو نبلو دلنا مالتي ازيوم دحر خطابت كغاطم زخل كحبرو يخلو ويكا علو مالتي كابو قصيلو ماكن قصصار حمام بيسي زستاي يقبر ازي مالتي بيسي كابي في الحاجر زوحب صبات يرين يقاصاصر هجي اتي كابتوم حكاين ديو كابتوم كاب حزبي ديو زمصه زي اكاد زي زستاي ببر يريو يقبلون يريون مالتي هابسي المقصال اتي بعد سلطان ون ناي بيسي نمصا يزوحب كتابات لبواتاتن زم حلالف مالتي يزخون دلو ازي كنريو خلنا ازي كلتيهم السم اتناي بيسين اتي بدحري لها سرعت مكتتال الوتاو اغاطامي دحر كتابت كندا تقبلوا زمامي يدخون دلو مالتيو خا خاتاتيلو يمميو مالتي نت صصاب امولوتي حجر ناي كندا كوغوان زخل مالتي حد اغاطام ختكون تخيل بزح كون خيل نمللاي كن من داين از الصراحه زي نايزي Canadian Adverse Events Following Immunization Surveillance System نبلو دلنا السو يقاصاصورو مالتي كابز قصيلو تناي علما ودبطنا عبراوي مدب مقصصار مدحني كاب 75 هاجرات انتلاي كندا صاب يقبل ازي علم لخاو صاب بمطقم كدحنت كتابت من قصصارن من اللاين يتقملوا مالتي እዚ ሕጂ ና ኮቪድ-19 ጥራይ ወይ ኮቪድ-19 ጥራይ ዘይኮነ ድሆነ ዓይነት ካለ ዓይነት ከታበት ኩሉ ዝኽእል ናይ ንፊዮ ኾን ኽእል ወይ ካለ ዓይነት ዝኾነ ዓይነት ሕማም ኾን ኽእል ነዚ ኩሉ ዝቆጻጸር ዶክተር
Okay, And I just wanted to add here, as a result of this AEFI monitoring system, you must have heard that AstraZeneca has been suspended for use in people below 55 years of age. So that happens just because of this AEFI monitoring system, because cases of some clots occurring in some female patients below 55 years of age emerged, and so action was taken, and now it has been restricted for people below 55 years of age. So that means like safety is always a big concern, because the vaccine is given to healthy people. So first concern is always safety. Tamret, please.
حجي بمسرت نيزة مالتي إذا أسترازينيكا دبهال نتحتي 55 عامت سعد ميم تخلتي له معناتو أب ناي مرقع دم أب حنتي قال أنستيتي سلازر قوانفة إذا حجي بقو مسرتي معناتو مجمرة نتعيات سبات سلازوها ات مجمرة وحسن نجي كدحنهم وحوس كي مفلاد دكتور.
So as of this slide shows the total number of vaccines which we will have in future in Canada. So these are the companies, these are the name of the vaccines which Canada has undergone advanced purchase agreement. And as we know today, we already have Moderna, Pfizer, BioNTech, Astrazeneca, and Johnson & Johnson available. And a few of these candidates might come in future. The only thing to note here is like all of these are like 2 doses vaccines, except for Johnson & Johnson, which is a 1 dose. Tablet, please.
أزيم حجي إتهم دمر نايتم كندا كأتو صدقوا زستاي قدمة سمم استقبلوا لهم نخلصوا زيهم يمالتي كابزي مودرنا زي فايزرنا جونسون زي ذات ألو ما بزي جونسون إن جونسون كلهم زيهم ككلتا زوسودو ككلتا عقن ناي كتابة اللغة.
Okay, so globally, this slide gives you the global picture. So globally, 13 vaccines have been authorized from multiple countries. There are some from Russia, from China, from India. So globally 13 vaccines, and there are still new vaccines are in the pipeline. So they are in either phase 1, 2, 3 of clinical trial. And in Canada, we have 4 vaccines which are approved or which has already on the ground. Pfizer, BioNTech, Moderna, AstraZeneca, and Janssen. And Janssen was the last one. It came on, like it was approved on March 5th. So this is Astrazeneca vaccine, as I mentioned in this AEFI slide, that the AstraZeneca vaccine shots have been suspended in people below 55 years of age as a precautionary measure. So people above 55, it's safe for them. So they can get this vaccine. They are getting this one also, but these are the 4 vaccines which are being used in different provinces in Canada. Tamara, please.
ስለዚህ ኣብ ዓለም ሙሉእ ጸዲቆም ዘለዉ 13 እዮም ግን ኣብ መስርሕ ዘለዉ እውን ካልኦት እቲ ፈላለዩ ገጻት ኣብ ቀዳማይ ገጽ ኣብ ካልኣይ ሳልሳይ ገጽ ዘለዉ እንደና ኣብ ፈተነ ዘለዉ እውን ከባቢ 59 ሕጹያት ኣለዉ ኣብ ልዕሊ እዚ እውን ተስፋ ተስፋ ዝተገብረሎም ሕጽያት እውን ኣብቲ ናይ መጀመርያ ምዕባለታት ዘለዉ እውን ኣለዉ ካናዳ ኸ 4 ካብዚኦም ኣጽዲቓ ኣላ ማለት እዩ እዚኦም ከዓ እቲ ንሪኦም ዘለና ፋይዘር ባዮንቴክ ሞደርና ኣስትራዘኔካ ቫክሲን ጃንሰን ኮይኑ ጃንሰን ከዓ እቲ ድሒሩ ዝጸደቐ ማለት እዩ ኣብ መጋቢት 5 2021 ጸደቐ ማለት እዩ እቲ ከምቲ ኣንቶይ ዝበሎ ዶክተር እታ ናይ ኣስትራዘኔካ ከምዚ ካብ 55 ንታሕቲ እዩ ዝዕድሚኦም ሰባት ከይወስድዎ ንግዚኡ ከም እቲ ኮሚቴ ንግዚኡ ኣወንዚፍዎ ኣሎ ማለት እዩ ዶክተር
So now we go a little bit of details on these two Pfizer and Moderna vaccine, with like just these two vaccines. So these vaccines, as we all know about all those 4 vaccines which have been approved here, they protect against infection from SARS-CoV-2. These vaccines will make your bodies produce antibodies and those immunized cells, immune cells, CD8, CD4, CD4, and memory cells. And it is safer to get the vaccine than to get COVID-19. Why? Because the vaccines, these mRNA vaccines, they don't have any live virus, so they cannot give you COVID-19. And operationalization of like operational part is the vaccines are being provided first to those who are at increased risk of exposure or those who have high risk of developing complications. So this is how vaccines are being distributed in BC. Tamara, please.
Thank you. حجي نحن خدتم كنزاربلهم صنح 4 كتابات زوم كلتا طرينا حتى نزارب بزعبا مودرنا فايزر بايونتيك مالتي حجي زيهم زوم كتابات انصار سارس كوف 2 اتي كوفيد-19 زمص فيروس يكلاخلونا مالتي اتي كتابات ناكالات كصره نفسات كم زفر يبرو فيروس انت تقاليخا نخيتحمل يكلاخللكا مالتي كاب كوفيد-19 متحس نتي كتابت موساد وحسنت دما ألو اتوم كتابت هيوت زلوم ايكون سلازي كوفيد-19 اي حزناني مالتيو كابزيو كم تعنتو يزبلو زتراخمو ويزموتو ويقالك كفالو نايتوم فيروس ترأي دلو سلازي هيوت دلوم سلازي يكونو اي حزناني كتابت نتون أبزوانزي أبتي زكاية دلو مالتي من كتابت موحب أبزن كفلها قربيسي نتون زيادة حادقة مقلع كقات ممزخل سباتن ويكا زيادة كبيت ساقمات كفتر اللهم زخل يوحب اللهم مالي بتحمان تتحيزون زيادة كتقعلو زخلو سبات نعم ويكا أبتنايكم كتقعلو زخلو بوتا سلسورحو نعم أن مكرخال تبهيل زيهم قدامنت نزيهم يوحب اللهم Doctor.
So if you had or you may have had COVID-19, if somebody had COVID-19 or they think they had COVID-19, they should still get the vaccine because you may not be immune to the virus and you could get infected again. So anybody who thinks they had virus or they had confirmed COVID-19 illness, they should still take the vaccine. It will take about 2 weeks after taking the first shot to develop immunity. So in that period, you could get it again. After getting the vaccine, continue to follow public health recommendation. Even if we have received both the doses, still everybody needs to follow up on the public health orders. Those are physical distancing, putting mask in indoor places, frequent hand washing. So these are the basic recommendations which should be followed until and unless we come out of this pandemic. Tamara, please.
Thank you. Haji, أتي يهلوكا أيهلوكا كتوسد أتي يهلونا كنوسدو يمرت مخنياتو نت فيروس ولا قدم حجي حيزنا انتخونا نبدأ حجي حيزنا نيرمو حجي دحاني عيدلين نيوزنا ندحراي كحزكا سلزخل ولا انتخمو انتخونا كنوسدو يمرت نتي كتابت مالتي إتاني مجمرة كتابت تسرح كلتا سمن عبيدو يزوسد كلمة زوان مزي وي أوشت زوان كوفيد-19 شعت أنت تغالي هنا ملو بملو أي كذا لنا نخون سلزي كوفيد 19 كحزنا يخيلي على شيء كاب وصلنا تي كتابة دحري موسادنا تي حزباو طعنا كنكتاتلون كنصعبون تي دوحاب لبواتاتن حبريتاتن كنكتاتلو علنا أزخا تي مرححة تي قبرو دلنا تي نايقت فيس ماسك مقبار دي تي إيدكا محتاب ويسانيتايز مقبار زيتات كله كنقبر علنا مالك.
Thank you. So you should not receive any other vaccine until 2 weeks have passed after you receive first dose or second dose. So no vaccines until 14 days have passed. Once you will, when you will go there to get the vaccine, you will be given a aftercare sheet. So in that aftercare sheet, there are recommendations like suppose if you feel pain, so please put ice packs. If you feel a little bit feverish, you can take Tylenol. So all those instructions are there. Common reactions to these vaccines could be tiredness, headache, fever, chills, but usually they will last 1 to 2 days and you should be okay by then. The only contraindication, like who cannot get these vaccines, is if somebody had severe allergic reaction to the previous dose or to the vaccine component. So what are the vaccine components? So in mRNA vaccines like Pfizer, BioNTech and Moderna vaccines, it's polyethylene glycol. So if you are allergic to polyethylene glycol, if you know you had some severe allergic reactions to polyethylene glycol, you should not get these mRNA vaccines. And if you are allergic to polysorbate 80, then you should not get the Astrazeneca vaccine. Other than that, these vaccines are people above 16 years of age, they should strongly consider taking these vaccines when their turn will come. Tamrat, please.
Thank you. أنت عينت نايتي COVID-19 mRNA RNA reactions وكأتي ملسيكات وشتنا خمس زرار دايكوني ناخا COVID-19 كتابت مش وسدركا نخلط صوم وكأسرت معلتات كساعة حلف كان كتابت كتقبل يبالكان مالتي هجي كنجيش تقنانا كتابت كله عنا يخلي سلسي زين كلتا صوم مسحالفة إلى كنوصل زلنا مالتي هجي دحرت خطابت كنقبرو نخل كنكن مفلات أبزي الرأينا دولو أزي أبزي بمأتاو زا الرأينا دولو لا تبقو مالتي انتاي عينت كنخانات كنقبر كنخل كنتلت نخلنا إلى خبت أبنتات هذا أتي فترة نات رياكشن كان سخون أحبت دي ويكال إنجار ويكانزا نيجوادات تكبر سلسخل آيس باك برد دلوز هون أخن قبل نخل ويون كال تايلونول كنوصل نخل ناتي رأسنا خحن الناس خل مالتي محمد وبتي لوم الدخان رياكشن سابستيجيز ودلو ثناي دخان دي رأس محمد رأسني وانا أور خبلا كنايش وادا ويكاني ملقا قبود هنا كان زخ كورنا أجر تملاس زيتا وتم فوكستي زستاي نبلون دلنا مالتي reactions زي بحكي كاب حدا حساب كده معلتات كتصوم حوز خولين كوست وزي بلون سبات دبلو دلوخا كخونا ناي أزيو كبيد allergy لزجبرلهم سبعة تقدمتي كمسجله زيهم إزخاء كسامة معهم زي الأبزين على polyethylene glycol أب mRNA كتابت ويكا polysorbate 8 دولو أبزين أنا أسترازينيكا دولو زي انتلون كوستو يبلون يبلادو. Dr. Birendra, I have a question. It's what will they do, those people who have these reactions?
So then they can get other vaccines. Like if somebody is, because these are adjuvants like polyethylene glycolism. This is in 2 vaccines. So you could take Astrazeneca. If somebody is allergic to polysorbate AT, then they should not take Astrazeneca and Janssen. So they can take Pfizer and Moderna. That makes sense?
Okay. Thank you. حج انتي اللي حتى تصنح دحر كم عينة ناي allergic زخانة زستاي كم تصلوا مدخل خويني انتي كجبرو يخولو لأنه استفعل اتي استرازينيكا دي سمام عم تقولي اتي مودرنا كوستو يخولو اتخلق فايزر كوستو يخولو اتي كالاي كتابت صدقوا كتابت مسمع ساديو. Okay, doctor, continue.
Okay, perfect. Yeah, so people with these conditions, we call them spatial patient populations. Like if somebody has these conditions, they should strongly consider getting the COVID-19 vaccine. Why? Because these conditions have a higher chance of experiencing severe symptoms if they will get COVID-19. So what are these conditions? Anybody who has cancers, who is undergoing treatment for cancers, for diabetes, any kind of kidney illnesses, kidney disease, autoimmune conditions. People know like there are, if somebody has rheumatoid arthritis, osteoarthritis, lupus. So these are autoimmune conditions. So anybody who's under treatment for these ones, they should strongly consider getting COVID-19 vaccine. Pregnant people with heart disease, transplants, if somebody had transplanted organs, got organs transplanted, cystic fibrosis, this is an illness which manifests itself in very young age. So people know that they have cystic fibrosis, neuromuscular or neurologic disease, any neurologic diseases, GBS. There are people, those who have this diagnosis, they know that, oh, this is a neuromuscular disease. Then conditions, there are some conditions which are treated with immune suppressants. So if people are immune suppressants, or people with rare blood diseases. So all these spatial patient population, they should strongly consider getting the COVID-19 vaccine, because they are at higher risk of developing severe forms of COVID-19. Tamrat, please.
Thank you. እዚኦም ሕጂ እዞም ፍሉያት እዚ ዓይነት ሕማም ዘለዎም ሰባት ክወስድዎ ዝምረፁ ማለት እዩ። እዚኦም ከም ናይ መንሽሮ፣ ሽኮርያ፣ ሕማም ኩሊት፣ ሕማም ናይ ርእስኻ ምክልኻል ዓቕሚ ዘለዎም፣ ነብሰ ጡር ኮይነን ዝኾነ ናይ ልቢ ሕማም ዘለዎም፣ ካልኦት ናይ ካልእ ሰብ ሕዋሳት ከምዚ ልቢ ድዩ ገለ ኣብ ውሽጦም ዝተዋህቡ ትራንስፕላንት ንብሎም ዘለና ማለት እዩ። ሲስቲክ ፋይብሮሲስ ከዓ ሓንቲ ቆልዑቶም ዝሓሙ ስለ ዝኾነ እዚ ከምዚ ዓይነት ሕማም ዘለዎም ግን ክወስዱ ኣለዎም። ካልእ ናይ ኣእምሮ ወይ ከዓ ናይ ምትንታት ድኾነ ምስኡ ዝተሓሓዝ ሕማም ዘለዎም እውን እዚኦም እውን ክወስዱ ይምረፅ ማለት እዩ። ካልእ ናይ immune suppressants ዘለዎም ሰባት እዚኦም ከዓ ነብሶም ዓቕሙ ናይ ምክልኻል ዓቕሚ ብውሽጦም ከፍርዩ ዘይክእሉ ከምዚ ዓይነት ሕማም ዘለዎም ክወስድዎ ይግብኦም። ኣብ ልዕሊ እዚ ፍሉይ ሕማማት ዘለዎምን ናይ ደም ሕማም ዘለዎም እዚኦም ንኽጥቅዑ ዝያዳ ስለ ዝኽእሉ እዚኦም ምስኡ ከዓ ዝለዓለ ዕድል ናይ ከጓንፎም እዞም ሕማማት ማለት ከቢድ ምልክታት ከርእዩ ዝለዓለ ዕድል ኣለዎም። ስለዚ ናይ ኮቪድ-19 ክታበት ምርካብ ኣፀቢቖም ክሓስብሉ ኣለዎም። ዶክተር
So now we come on operationalization part. So we all know like the immunization in BC has been divided into 4 phases: first, second, third, fourth. So we are in the 3rd phase, and if you go on this link, www.2.gov.bc.ca, so you will get all this information. It's available in 12 languages. So you can click on the language below, and it's in Arabic and multiple languages. So, and it's updated based on the changes. So it's updated very regularly. Appointments, they can call this number. And again, this is the link which is here. And if you click on this link, you can get this whole information. So this one I have put here is Arabic one, but it's available in as I mentioned, 12 languages. So anybody can go there, or the way is to give a call at this number if your turn is already here and then you want to book your appointment. Tamra, please.
Okay. As a بعربي I don't speak Arabic and I can't read Arabic, but I had a chance to look at this earlier. So as a تقدمي جت كلا جت سلسة جت روعي جت إندابل يود كايرلو مجمرة نتوم أب long-term care like عند عبيت اللي يعامل دانت كوهاب كلاي جتوخا نتوم أب هوسبيتالات تسرحوا ويكاسفنا هوسبيتالات مالتي تحريهم إندابل عبيتي بدحري وخا نتوم حافشة بحزبي general public نملو كوهابي مالتي سلزي عبتا كالإيتي. Oh, sorry. This is Farsi. It looks Arabic for me. So.
Oh yeah, sorry. This is Farsi. Sorry about that.
This is Farsi.
It's written here Farsi. Yeah.
Okay. Sorry.
No, even I couldn't recognize. So sorry about that, because there was nothing in Tigrinya, and I think Amhari is the closest sister of probably Tigrinya, and I thought Arabic. Yeah. So, but then this turns out to be Farsi. So sorry about that.
Yes, yeah, you're right, because most of the Eritreans do speak Arabic and read Arabic, but I don't. Unfortunately, okay. I don't. I would have known if this was, but for me, Farsi and Arabic kind of looks the same. So up there it is. The Farsi. So okay. So in the next.
This is Arabic. Yeah. If you see here, this is Arabic.
This is Arabic. Yes. Yes. Okay. All right. ስለዚህ በዚያ አቲና thank you Masi she speaks Farsi, so thank you for the correction. Yes.
Okay, so I just wanted to share this slide also. So there is this website called immunizebc.ca, and there are questions like frequently asked questions. So I put this one question from that website, because many people are asking, can I choose vaccine? So when people ask, can I choose vaccine? So that means they think that this vaccine is better than this vaccine. And I think this is based on that, on the information which people are getting, that this is 95% and this is 69%. So that's why people are thinking about choosing it. But I just wanted to bring attention to this piece of information here, that all of the vaccines which are being authorized or which are authorized for use in Canada, they are equally effective. There's no difference in effectiveness of Astrazeneca or Johnson & Johnson or Moderna or Pfizer. So they are equally effective. What are they equally effective in? They are equally effective in preventing serious illness and hospitalization. So that is the main goal of vaccination. The main goal of vaccination is not to eradicate the virus. The main goal of the vaccination is to defang the virus. Defang the virus means even if somebody gets COVID-19, then they should not have to be hospitalized. They should not develop severe symptoms, serious illness. So that is the main purpose of these vaccines. And all these vaccines are equally useful, equally effective in reducing hospitalization, in reducing serious illness. So this is the message. So that's why I just wanted to put this slide here. Tamrat, if you could please say, yeah, thank you.
Okay, thank you. تحتو أنا يحيي كاب كله تزولو خطابتاتيا هجي سخاء كله وتسي تاوي يدب لنا دلو دكتور مالتي اتمرحانيت أنا اتخطابت نمدفع اتي حمام زي كونه انتايدا كاب حمام يقلق لنا اب هوسبيتال أتينا أو خين متن هوسبيتال كينا أتو أو خين دكسا كم زخا يكالا خلنا بر كل اتغتابت بمعرة زخستاي وتسي بيتاوي. Doctor.
Okay, so for future also, if you have any questions on COVID-19, so this is a very good website, immunizebc.ca. So go on this website, and on the right side you will see written FAQs, like frequently asked questions, and there are probably 50 questions. So please just if you have any of those questions, just click on those links and you will get a detailed answer. So authentic quality information is very important in pandemic, and we can't be everywhere. So there are resources which are available there, and they are the trusted resources. So please follow those trusted resources. If you get some message on your WhatsApp, on your WeChat, or any of the social media, always try to verify that message. Always look for authentic information sources, and this immunizebc.ca is one of those sources. Tamrat, please.
Thank you. እዚኣ እዛ ኢሚናይዝ ቢሲ.ca ነቲ ፅምፁም ዝኾነ ሓበሬታ ንኽትረኽቡ ኣብዚ እዩ ዘሎ። ሕጂ ቀፃሊ ዝሕተቱ ሕቶታት ወይ frequently asked questions ዝበሃሉ ኣሎ። ኣብዚ ሕጂ ከባቢ 50 ዝኾኑ ኣለዉ ሕቶታት። ሕጂ ካብዚኦም ከዓ እቲ ንደልዮ ፅፁይ ሓበሬታ ክንረክብ ንኽእል ኢና። ምክንያቱ እቲ ድመፅት ሓበሬታ ካብ እሙናት ምንጭታት ወይ ሓበሬታ ዘለዎም ሰባት ስለ ዝኾኑ እቲ ካብ ማሕበራዊ ድረገጻት ማለት ከም ሶሻል ሚድያ ንረኽቦ ንዕኡ እሱ ንኸነ እቲ ብኡድ ወሃበና ንኸነፃርዮ ወይ ንኸነረጋግፆ ናብዚ ብምምፃእ እቲ ንደልዮ حقኛ ሓበሬታ ክንረክብ ንኽእል ኢና።
Okay, so there is this concept of community immunity. Maximum people, we should try to get vaccines as early as possible. Majority people should get the vaccine. Why? Because this is the scenario. Because what we want is, we want this scenario. So when majority of the people are vaccinated, they are immunized. So even if people, this vaccine cannot elicit 100% immunity, or they cannot take the vaccine, still if majority of the people are vaccinated, this disease won't spread. But if we remain at this stage, so this havoc will continue. So we have to make sure that whenever our turn comes, so strongly consider taking the vaccine whenever your turn comes. Tamrat, please.
ሕጂቲ ማሕበራዊ ምክልኻል ወይ ናይ ሕብረተሰብ ምክልኻል እቲ ስርዓት ምክልኻል ዝብሎ ዘሎ ኮሚኒቲ ኢሚኒቲ ማለት እዩ። እቲ ኩሉ ብሓደ እንተ ካላኸል ተሎ ንኩሉ ይጠቕሞ ማለት እዩ። ሕጂ እንታይ እቶም ዝበዝሑ ድሕር ነቲ ክታበት ረኺቦሞ ገለ ከዓ ድሕር ኣዝዮም ውሕዳት ዘይረኽብዎ ተሎ ከምቲ ዝግባእ ዋላ እዚኦም ዘይረኽብዎ እዚኦም እንተሎ ከምቲ ዝግባእ ኣይ ማለት ከምቲ ዝያዳ ኣይ ናብ ካልኦት ሰባት ኣይመሓላለፍን ማለት እዩ። በዚ ከዓ እቲ ትቋፃፅሮ።
So we are done with the slides, and now we are open to questions. Any questions, please? Please feel free to ask any questions now. Yeah, we are done with the slides.
ናይሎም ኣስተምህሮና ወዲእና ኣለና ሕጂ ሕቶታት እንተ ለኩም እዩ ትብለና ደሎ ዶክተር Dr. Virendra, I don't know if there is, I'll read it. It might be a question. There's one here.
Okay, in the chat box?
Yes, but it's in Tigrinya.
No, I can't. Yeah, I can see it, but of course, like you'll have to help me. Yeah, so please.
Well, the question is, he's saying, first thing, thank you for the COVID-19 information. He is saying that the virus is spread from animals to humans. Can it be transmitted from animals to humans, as there are animals living in, for example, like cats and dogs living with humans? Can they pass from humans to these animals?
Okay, so that's a good question. So there has been no such report from spread from domestic animals like cats and dogs which are living with humans. But of course, there has been some strains which were found in minks. So mink is an animal which is farmed for its fur, and there were I think episodes in Denmark, then in US, then in Canada also. So there were some mink farms, so where it just went through all that population of mink, and they have to be culled. So having said that, that means like we have seen it in those animals, but we haven't seen any such episode of transmitting from domestic animals to humans or from humans to them. So as of now, no.
ጽቡቕ ትሕተያ ካብ ሚንክስ ዝበሃሉ እዚኦም ናይ ንጨጉሪ ኢሎም ኣብ ሕርሻታት ዝዓብዮም ኣብ ዴንማርክ ዋላ ኣብ ኣሜሪካ እውን ነይሮም እዚኦም ከዓ እሱ ምስ ተረአየ ኩሎም ተቐቲሎም ግን እቶም ናይ ቤት እንስሳታት ግን ስጋብ ሕጂ ግን ኣብኦም ኣይተረአየን ካብኦም እውን ክሓልፍ ወይ ከምኡ ዝኾነ ነገር የለን
Any other questions, any thoughts, any comments?
ካልእ ዝኾነ ሓሳባት ወይ ሕቶታት ወይ ርእይቶ እንተ ኣለኩም ሰላም ዳንኤል ተመሊሳ ትልካ ዶ ትኾን ተሓቶ
So I think we are all good then.
I think we are. I think. Can say Doctor. Thank you, Doctor. I can say.
Any questions, any thoughts?
Okay, I think there is one. He has one question. Yes, please go ahead. Al-Azhar حتى على المتبلع الخمو حتى له حتى one. He has a question.
Okay, please.
I think you. He's saying his test is positive for COVID-19 and he has headache for the last 8 days, non-stop. What shall I do?
Okay, so I cannot answer that, yeah, because you have to talk to your family physician, yeah. So you have to talk to your family physician, and whatever drugs are you taking, or I don't know, yeah. So please refer to your physician, please, yeah. Sorry about that, yeah.
Okay. سمي أخذ خوندو تخون الأزهر. And Dr. Ka, yes, he has heard you. I know. Go ahead. I know. كتزارب. Okay. كتزارب لليخي. دحر. Okay. And one. Okay. Is it mandatory to take the vaccine?
It's not mandatory to take the vaccine, but people should strongly consider getting the vaccine, because this is the only way out of this epidemic, of this pandemic. So this is the only tool we have in our hand, which is the safest and the trusted and the efficacious one. So it's in the end, it's up to individuals, but again, people should strongly consider taking this vaccine for sure. This is the only way out.
معزة قديتها أيكونين إزت رأيتي عندي موت مالتي سبات كحسبلون كبروا زيادة كألوم مخنياتو إزي عندي حدا أمرت موت إنزلنا.
But if you have any doubts, you can ask questions. Maybe I can help with or I can share some resources if I can clear some of your doubts. Yeah, maybe.
ግን ስክፍታታት እንተለክ እንታይ እዩ ድሕረይ ገለ ነገራት እቲ ናቱ ንዋት ወይ ሪሶርስስ ዝኾነ ከካፍለኪ Okay, one has raised. I'll allow her to talk.
Okay.
Salam አይኖም I'll ask you to unmute. كتزارب تخليخي سمعنا الله عينه عينهم بصحف عبتي chat box كتصحف لنا تخليخي What Maaza is, this is a follow-up question for the last one. What she's saying is her arms gets swollen if she gets an injection. That's why she's asking.
Okay. So I don't know, Ainam, like when was the last time you took a shot? But nowadays, here in Canada, the needle which is used for vaccines, it's very fine. It's a pediatric needle. Pediatric means like which is used for children. So it's very fine. You won't even feel any pain. And after that, once you get the shot, so it's recommended, like suppose you had in the past you had that swelling, so the best thing to do is to put ice packs for first 3 days. Okay, so put ice packs and you should be good by the next day. And if you feel a little bit feverish, as mentioned in this aftercare sheet which we will get, so you can take Tylenol. And for most of the cases, it's enough. It's just enough. So it should not happen. Yeah. And again, once you take the shot, so you are asked to wait there for 15 minutes. Like if you have any allergies, so there are pretty good arrangements. Yeah. So think about it.
معس وسيد كمار في أي فلتني مالت معس توجي خنير كده خونه كتابة جن إزنايلهم أبتنا دان تقومر لا أزي ده مالس أزي إشتري تمر مرافق نقول عت تقومر مرفي تقوم بلو آيس باك ويتناي برد زملانا أشتو زستات السنة سلسة معلتي كتبلو تبعي وخانا رسمي قال أنت سيب الكخا تايلانول مرحاني توستو مالك عاو معسرت حمشترا تتعين حندي في تخانا زستاي أنت حالي مالتي تخانا رياكشن كيفو عاو تتعين حقي أبتايكلنا. Okay, I have, this is, would someone, if someone wants to travel and would he not be allowed to, would anyone be not allowed to travel if they haven't taken the vaccine?
No, this is not the case as of today. So like everybody can travel. There are some other recommendations that you should get the PCR test, and it depends from countries to countries. So as of now, there is no such recommendation that you cannot travel if you don't have vaccine. Like we don't know what will happen in future, but as of today, at least in Canada, there is no such recommendation. Yeah, no such instruction.
مرمرات ببرو على كارير بالكلام تريكوني جن متعاقن عين فلتن حجيكم سابزلهم معلتكم كونوا يلا.
I think I'll discuss this slide. Why should you strongly consider taking COVID-19 vaccine? Your loved ones need you. So this is the only way you can be with them when they will need you. Okay. Doctors and nurses, they have already taken it and they recommend that you should also take them. So you have to think like you should strongly consider taking the vaccine. And this is the only chance to return to the people and places we love. So otherwise, if we keep on delaying everything keeps on delaying. And this vaccine, like I'm talking about the vaccines which are being given in Canada, it was tested for 70,000 people. Already 14 million people have gotten it. And as we have talked about, there is a monitoring system for side effects, for everything. So so feel safe. So go up and get vaccine when it's your turn. Okay.
جلمنتاي نخمستو دلنا سي نفكرهم سبرانا سي يدلي مالتي يدزينا يوم سلزي السو كتابة بالموساد أبقون نعم مسؤول علنا مالتي كالي توم حكاين نرسات وسيدون مالت مخوصتو نتي COVID-19 وسينهم حجها السخاون كتوسطو يمدي لابو وين حناون كنوسطو يمدي لابو سلزي نتناتنا دكتور لمنتاي زيادة مفلات منتاي قناع ناقر مخانس سنوسار مفلات ناتنا دكتور كنزارة ربو نخير مالتي حجي Okay. إذا حاجة عدلها بنالو نفكر روبوتاتن سباتن نخل ملس مالتي نجي هيوتنا نخل ملس تز أنا بابرانا أتب نبرة نخل ملس مالتي نجي سلزي نمزكب سبلنا للو نتي نخل مركب نتي كتابة قبل سبعة تفتشيني زيناي كوفيد-19 تعرف لألي 14 مليون سبعة كأول شيء لما حجي تعاملنا زي وحسن وزي تعامل معنا تدرينا حجي إحنا كنوستو ريجانا Doctor,
yes,
if you have anything to add, we have 5 more minutes.
No, I don't have anything to add. If people have any questions, so please, or otherwise we'll call it a day. Yeah.
Okay, just one question. Okay, and it's about the blood clotting you've talked about. What are their chances of getting well again? That's the question.
What are the chances of getting
well? Are they okay?
I didn't get it.
Yes, there were some people who took the
Astrazeneca vaccine.
Yes, and they had blood clotting.
Yeah. Okay. So what was the frequency of that? So 37 cases. How many? Okay. 37 cases happened in 17 million people. 17 million people got the shot, and 37 women got this blood clot, and it wasn't fatal also. So and they were all below 55 years of age, so that's why it has been stopped in men and women below 55 years of age. So until more evidence comes and they are investigating, so it has been halted as a precautionary measure until then. Does that help?
Yes. Untitled dolo tom sabat absalasan shoaten dekanistio tati dekanistien ab any terai zuha khab 17 ሚሊዮን ሓደገኛ ها ኣይነበረን እቲ ደጓነፈን ማለት እዩ እንጂ በዚ እቲ ደው ኢሉ ደሎ እቲ ካብታቲ 55 ዝዕድሚኦም ሰባት ሕጂ ተመሊሳትኩም ተስፋ ገብር ሓደገኛ ኣይነበረን እታ ናይ ምሕዋይ ዕድሎም ከመይ ይመስለካ እንድያ I think what they are saying is the question, if I'm right, are they hospitalized or the people that had this blood clotting? That's the question, I think.
Okay, so this is global data. So this is not from you. This is not from Canada. This is from UK, EU, and Canada and other countries also. So I don't have much details on that, but the thing is like they had like the diagnosis was like clotting, but I don't know the outcome, whether they were hospitalized or what happened to them, but I only have this much information. And this is also like this data is like around a week ago. So around a week ago when this measure was taken, like on March 29th when this was stopped. So before that, this is what the report was, like 37 cases in 17 million doses administered. Yeah, so
ዓለም ለኻው ጸብጻቢ እቲ ማለት ብልካ የብለይ ስብለና ደሎ ዶክተር እቲ ሰራኤ ኸኣ ካብ 17 ሚሊዮን ሲ ሰንተን 35 ግን ንጹር እቲ ሓበሬታ ኣይ ናይ ዓለም ለኻዊ ካብ ኩሉ ሃገራት ዘጓነፈ ግን እቲ ንጹር ማለት ከምታ ተሕቶ ዘላ መሰረት ማለት እዩ ናይ ኣብ ሆስፒታል ድማ ካልእ ሓበሬታ ይብሉ Okay, another last, I don't know if we have time for...
Yeah, sure, we can take it. We can take it. Please, please.
Okay. All right, thank you. What is question is the effectiveness of the vaccine on children under the age of 1.
Under the age of?
1.
1?
Yes.
So as of now, none of the vaccine is recommended or is being given to people below 16 years of age. Okay, so there are Pfizer-BioNTech and Moderna. I think Pfizer-BioNTech. So they are testing these vaccines in children. But as of now, the recommendation is only for children above 16 years of age, above 16 and above 18. So for like above 16 and above 18. So as of now, nobody below these ages is getting this vaccine. Okay.
እቲ ክታበት ካብ 16 ካብ 18 ዓመት ላዕሊ ጥራይ ደለው ትሕቲኡ ዘዕድሚኦም ግን ወሃቡን እዮም ዘለው
Okay, Tablet, I think we'll call it a day.
Okay. Thank you, Doctor. Thank you for your time. This has been very informative. And as some of our participants have said, that they are very okay, yes, thank you for the information. It's the same question that was repeated. I was just reading it.
Okay.
So yes. Thank you. This is all for we have for today. I don't know if Masi has something to say, but I don't.
Dr. Sharma, thank you so much for all the information you provided. I really appreciate the time and the information that you shared with the clients. We truly appreciate it and hope to see you soon. And please stay safe. We need more of you.
Okay. So thank you, everyone. Thank you for your time, and let's hope that we'll meet together. Okay, take care, everybody.
Thank you. Have a great night.
Yeah.